Welcome to the Best Infiltration Techniques video series. Guidelines Central recently convened the Best Infiltration Practices Working Group to achieve expert consensus on the use and optimal administration of local analgesics in common abdominal surgeries. The use of intraoperative local analgesics is recommended in major post-surgical pain guidelines because surgical site infiltration has been proved to reduce post-surgical pain and the need for opioids. Wound infiltration in abdominal surgery provides the most benefit when it is part of an overall multimodal post-surgical pain strategy and when it is part of an enhanced post-surgical recovery program. Critical to its success is the surgeon's infiltration technique and keen knowledge of the wound's anatomical structures. Here are a few key points that are critical to achieving optimal post-surgical pain outcomes. Improving local analgesic administration techniques can facilitate ease of use and benefit to patients. In order to maximize the effect and duration of analgesia, it is important to improve infiltration techniques for subcutaneous tissue and place local analgesic into deeper myofascial and peritoneal tissues where neurons are dissected and pain foci often arise. It is important to remember that the total local analgesic volume required to adequately cover a wound and systemic local analgesic levels are dependent on an interplay between total dosage administered, any additives, and the relative vascularity of the specific surgical site of injection. The likelihood and intensity of a potential systemic local analgesic toxicity varies with specific local analgesic used and is subject to cumulative local analgesic dosages administered. Local analgesic should always be injected slowly into soft tissues of the surgical site, with frequent aspiration to check for blood to minimize the risk of intravascular injection. Aspirating while inserting the needle and injecting while withdrawing the needle further reduce risk. In addition to generous administration to the dermis and subcutaneous areas of an abdominal incision, special attention should be given to providing adequate local analgesic deep to the anterior abdominal fascia, where many myofascial nerve endings reside. The recent addition of a 72-hour liposome formulation of bupivacaine substantially and favorably alters the paradigm for evaluating and using surgical wound infiltration to reduce post-surgical pain and minimize the use of opioids and their side effects. The technique demonstrated in these educational videos utilizes a 1.3% suspension of liposomal bupivacaine diluted with normal saline in order to cover the full extent of the wound. So whether you're new to infiltration or an experienced infiltrator, we're certain you'll find this Best Infiltration Techniques video series informative and useful to your surgical practice. Let's begin by clicking on one of the infiltration technique videos in the table of contents.